What's up, everybody? Hello, how are you? It's been a little while since I've done a new taping here at Hazleton Eye Specialists, so we are excited to start out the new year with some great new information. We are here and so excited to see you. We are located, as you know, on the Airport Beltway in Hazel Township, Pennsylvania, our flagship office, Hazel Township. That's 281 Airport Road, Hazel Township, PA, 570-453-2020. Give us a call. We are also located in Tannersville, that's called Stroudsburg Eye Specialists in Tannersville. Beautiful strip mall right off of 611 down the road from the Tannersville outlets. And then don't forget about our brand new location in Pottsville. My goodness, that office is just off and running, doing a wonderful job serving the wonderful people of Schuylkill County. That's 541 West Bacon Street in Pottsville. Give us a call there at our number here on the screen. So excited to be here with you today and talking to you about a really exciting, maybe not so exciting, maybe it's boring, I don't know, but it's exciting to me, something called presbyopia. Presbyopia is one of the only guarantees in life. Yes, gray hair, wrinkles, taxes, and presbyopia, right? You've heard that saying. I'm just kidding. Maybe you've never heard that, but at least that's what I say. Those are some of the things that we can all be guaranteed in life. So what does presbyopia mean, and why are we talking about it? Well, presbyopia literally means old eyes. I know. I'm feeling a little bit of that myself. I'm getting some gray hairs here, and if you've seen any of the shows recently, you might have seen some of my kids, and maybe that's why, I don't know. But presbyopia means old eyeballs or old eyes, and it's a guarantee for all of us that as time goes on, we're going to start to notice a change in our vision in our mid to early 40s. And it's sometimes a awkward conversation that I have with patients. I look at their date of birth and I see their age and I say, have you noticed a difference as it relates to your ability to see up close? Yes, the question. And the room goes silent and the patient looks at me and very confidently says, no. Well, little do they know, I've already had my technician measure their vision both far away as well as up close, and we get a measurement of the quality of their vision. And so we know, based on our knowledge of the human retina, that is the tissue in the back of the eye, and the structures that allow light to focus on that tissue, that our human retina should be able to see what we call 20/20. And so we have these beautiful little charts in all the rooms that have some pretty much worthless information on it, and you read through them and you're testing whether or not your retina is able to see what we call 20/20. And so we want to be able to measure that and see that here in the office. And we have a lot of different ways to test that. We can have you close one eye, look with one eye, close the other eye, look with the other eye, and look out onto the chart at the wall. And that's testing your distance vision, your ability to see road signs, your TV, different things of that nature. And then we'll often hand you a piece of paper, like I said, to test your up-close vision. And generally speaking, we hold that your near vision is approximately 40 centimeters or 16 inches from the tip of your nose. And generally speaking, when we look to read something, we don't hold it up here. We usually hold it down here. And in doing so, we call it a bent arm's distance away from the face. And so in today's world, that might be your cell phone, your tablet, could be, out at the supermarket looking at a label, or maybe even a restaurant and a menu. And so those are some of the things that we're going to be asking you about. Hey, do you have any trouble with your cell phone, a tablet, a computer, or some of those other things that I mentioned, and ask. And so a lot of times people will say, no, I'm doing just fine. And so again, this piece of paper that we're giving you gives us the opportunity to measure the quality of your vision up close and give us a number as to whether or not that's normal or abnormal. Now, what sometimes happens is for some individuals, when they're starting to notice a change in their ability to see up close, they may start to do this. And then they run out of arm space. And sometimes I think people start to realize or start to think that maybe their arms are just getting shorter and their eyes aren't changing at all. But they would be wrong. And what's really going on here, and what's really going on when we look up close, is there's a lens in the eye. So this diagram here is going to show you exactly what is going on when we are looking up close as compared to looking far away. So I always tell patients when we're looking far, our eyes don't actually have to do any work. They're just looking far. They're just seeing far. No physical energy or exertion occurs. But when we look up close, there is physical energy and exertion exerted. And so what actually happens is there's a muscle inside the eye, and you can see that here in this picture. It's called the ciliary body. And that muscle runs in a circle around the eye, and it has attached to it these little fibers called zonules. So you could see those little fibers, zonules, attached to that muscle called the ciliary body. And that muscle and those fibers are attached to a lens. That lens is about the same size and shape as an M&M in real life. And what happens is when we look up close, that muscle constricts, those zonules pull, and the lens changes shape. So you could think about your cell phone or a camera lens. When you're focusing your camera or your cell phone on an image, you might see a focus, a blurry, a clear occur until it comes into focus, until the lens changes its shape to focus on the object you're looking at. And the very same thing happens inside of our eye. And what controls it is our brain and our brain's awareness of what is close to us. The closer you hold something to your face, the harder that lens has to work as a result of the muscle flexing. And so we know that presbyopia, or old eyes, causes us to have more difficulty with that focusing mechanism. And again, the closer you hold something, the harder it is that your eyes will have to focus. And as I said, everyone is a subject to this in their 40s, no matter what prescription they have, no matter what kind of eyes they have, no matter what kind of family history of eye conditions they may have, everybody is going to notice this at some point in time. Presbyopia waits for no one. And so this is something that is totally normal and not anything to worry about, but something that we have lots of different ways to address. So when we come back from a short break, we're going to talk about all the ways, old and new, that we can take care of the holy grail of eye care, and that is presbyopia. Hey everybody, we are back, and boy are we excited to talk about presbyopia, old eyes. I'm just kidding. That's not a real nice way to say it, but it is actually what it means, presbyopia, or aging vision. And we said in our first segment that presbyopia is in fact a loss of the flexibility of that lens inside of the eye. And before the age of 45, that lens inside of the eye retains the ability to flex. It retains the ability to variably focus, like our iPhones and like our camera lenses. We simply point, click, and focus wherever we want that image to be clear. And our brains have the ability to do that as well. The closer we hold something to our face, the harder it is for us to focus. And so when we start to notice this change in focus, we start to adapt. Our brains are amazing things, and they do this without us even realizing it. And we start to push things further away. Not because it's easier to read your cell phone over here, but because our eyes will have to focus less, and it allows us to see more clearly. So that's probably the first sign to you out there in TV land that you are experiencing presbyopia. So what do we do? Well, it's not an emergency, but there's lots of different things that can be done. And there are pieces of evidence going back literal millennia as to how it is that we treat, correct, or help people with presbyopia. Because certainly if we have difficulty seeing our cell phones, it may be that we're also having difficulty doing some really important things like taking care of ourselves, eating food, and many other tasks that come with, near vision. And so probably the first thing that we think of, or maybe we're recommended to do by a friend or, a loved one is, why don't you just run to the local supermarket or pharmacy and grab a pair of those reading glasses. They'll help you out. And you know what? They're not the worst thing in the world. There's nothing wrong with a pair of reading glasses per se. But the thing about reading glasses is we're going to go ahead and grab a treatment for something that really is not made for you and your eyes. There's been lots of studies done on the human visual system, and there's something along the lines of 2% of individuals that have the same eyes. One eye is exactly the same as the other. And so that means that when you put a pair of glasses on that are made for each eye the same, you're not getting the clearest vision that you possibly can with those reading glasses. But for many people, they work really nicely. One of the difficult things about reading glasses, however, of course, is that when you put them on, difficult time seeing far. They're just made for up close. So certainly reading glasses are helpful in the moment, but one of the difficult things about reading glasses is it just doesn't seem like you have them when you need them. And so a lot of times I'll see patients after many years of over-the-counter reading glasses wear, and one of the things they'll say is, yeah, I have a pair of reading glasses at home. In fact, I have 27 pairs of reading glasses at home, one in every room, then in my pocket and in the car and here and there, because you never have them when you need them. You want them where you need them. And in our world, with cell phones, watches, and other things we need to be able to see up close, you just can't have enough. And so that seems to be a very common thing. But there's other options. Other options would be, if you're already an eyeglass wearer or contact lens wearer, there are eyeglasses that are designed to help us see both far away and up close. And this is where we start to have that conversation about the dirty B word or bifocal, or the dirty P word, progressives. And, the bifocals and progressives of the world, I know, really make us start to feel old. And this is always an uncomfortable conversation for patients. But the idea here is that we're going to do a comprehensive eye exam, which, for many people in their early 40s, this is when the first time that they start to notice that there's anything wrong with their vision. Maybe they had 20/20 vision their entire life, and this is the first time they started to notice that something was wrong. And so now we have the opportunity to not only help that problem, but make sure that nothing else is going on inside the eye. And many very serious conditions inside the eye occur without you ever even having a clue that they're there. Glaucoma, macular degeneration, and the identification of literally hundreds of systemic conditions like high blood pressure, diabetes, and hypercholesterolemia can be observed by looking inside of the eye. So it's an opportunity to really check your eye health and make sure everything's good and get an individualized level of care for your ability to see up close, which obviously is so important. So a progressive lens may be the way to go, a lens that you could put on and be able to see the TV, be able to look down the aisle in the supermarket, be able to see while you're driving, and at the same time, look down, look and read your dashboard of your car, your cell phone, or your computer while you're at work. So the ability to be flexible. And I think one of the biggest things that I hear from patients about this particular option, well, I don't want to have to wear glasses all the time. I don't need them all the time, and in many cases you don't. But it gives you that flexibility, it gives you the opportunity to be able to see both far and close. And boy, the progressive lens designs that we have at Hazleton, Stroudsburg, and Pottsville Eye Specialists are really second to none. The way that these lenses are produced is unbelievable as it compares to how they used to be produced. If you've ever tried a progressive, or you've heard about a progressive being blurry or having distortion on the sides or causing a swimming feeling, this is a thing of the past with progressives that we have now. The progressives that we have now are what we call digitally designed and surfaced. The level of specificity that these lenses have, starting with the correct measurement here in the office, allows for the significant reduction of what we call non-adaptation, which was a real problem that we experienced in the past and really isn't now. So if you've had that experience where you've gone and you've been recommended a progressive lens, this may be an opportunity for you to go ahead and try that again without having those negative consequences. So we have over-the-counter readers. We have prescription glasses that are made for you so that we can create a prescription that's individualized to your two different eyes. Just like your eyes, you know, your fingerprints are not the same. Same with your eyes. Very unique to you. No one has the same eyes as you. So getting an individualized prescription. And the second option, as far as an individualized prescription goes, is contact lenses. I cannot tell you. I think today I heard it 3 times. I can't tell you how many times I have heard that I went to another eye doctor and they told me because I can't see up close, I can't do contacts anymore. Well, that is just totally wrong. Contact lenses have now been produced to help with people being able to see both far away as well as up close. They're called multifocal lenses. Lenses that give you the ability to see normally and naturally both far as well as close. These lenses are really amazing and really allow for you to continue to live a life that's unaffected by presbyopia and not have to wear glasses. And I know this is a big thing right now, especially with the use of masks in many different scenarios and environments. Sometimes patients that were wearing glasses before without problems, sometimes progressive lenses, are now wanting to look into contact lenses. And what you need to know is if you've been told that you could not wear contact lenses previously because of being able to see both far as well as close, and they said it didn't work for you, that's just wrong. We're up for the challenge. We're happy to help you out with that. So, coming back from this break, we are going to talk about the third big thing as it relates to presbyopia, and that's the next frontier, eye drops that could help you basically toss those readers to the side and not need them. We'll see you real soon. Hey everybody, Dr. Deom here, and I cannot tell you how excited I am to tell you a little bit about a brand new thing for presbyopia or old eyes. I can't stop saying that because it makes me giggle. I'll tell you, so many things in our life we have figured out ways to slow down, stop, or even turn around as it relates to the aging process. The average age, hundreds of years ago that we would live to was probably 20 years difference than what it is right now. And you look at how we progressed, but when it comes to presbyopia or being able to see up close, we really haven't done much to turn the needle around on that. We're still using reading glasses that they were using hundreds and hundreds of years ago. So here we are now, and we finally have a therapeutic option to help with blurry near vision or presbyopia. That's blurry near vision. We're here at Hazleton Eye Specialists. If you haven't heard of us, give us a call, 570-453-2020. We have a team of doctors that really goes above and beyond for you and your family, all ages, from newborns all the way on. Dr. Kislin started the practice here, very passionate about dry eye and care of patients of all ages. We have Dr. Bellinger. Dr. Bellinger, fantastic eye care provider, new mother, so she loves seeing the kids as well as all ages, and she's in our Hazleton as well as our Tannersville office. We also have Dr. Olzinski. Dr. Olzinski is our veteran in the Stroudsburg office, and people just absolutely love Dr. Olzinski. He's really got that kind, compassionate, and just soothing approach to patient care. Just a wonderful person in general. And also our two newest providers, Dr. Brendan Connors, who is in our Pottsville as well as Hazleton location, and Dr. Akira Saran, who is our newest doctor doctor here at Hazleton and Pottsville Eye Specialists, and everybody is just so excited to get you in the office and teach a little bit about your eye care, your eye health, and different things that we could do to make your life easier. And so we're here today talking about presbyopia. Presbyopia affects 128 million people in the United States. And that's because it is one of the things that we can guarantee will happen to you throughout your life. Taxes, gray hair, wrinkles, death, presbyopia. These are some of the things that we can guarantee. 128 million people. And out of that, and just to put that in context, only 3 million people get glaucoma. Somewhere along the lines of 12 million or 18 million people get heart disease. 128 million currently have presbyopia. Out of that 128 million, 30 million are using over-the-counter reading glasses and probably have never had an eye exam. And so my appeal to you today is, if you are sick and tired of using your reading glasses, you've never had an eye exam, and you've been using them, and you're wondering, boy, it seems like there should be a better way. There is. There finally is a new treatment for presbyopia. It comes in a bottle. It's an eye drop. It works within 5 minutes, and it lasts for about 6 hours. The exciting thing about this new eye drop is it's been around for 130 years. This eye drop, this medicine, has actually been around for 130 years. It's a very well-known, well-understood, safe medicine with a track record of safety in eye care and in medicine in general. It's called pilocarpine. And this is a medicine that has been shown to be very safe in many different aspects of healthcare, but it's been used in eye care specifically for the treatment of something we've talked a lot about on the show, and that's glaucoma. So glaucoma, as you know, is a condition that is a degeneration of the optic nerve, the structure that connects the eyeball to the brain. And we've identified that lowering the pressure inside of the eye actually can have an effect to protect the optic nerve. So we've often discussed glaucoma in the presence of eye pressure and lowering it. So it's been shown that using pilocarpine of old, not new pilocarpine, not Vuity, which is the medicine that we're talking about here today, pilocarpine of old at a much higher concentration with a different what we call vehicle lowers the eye pressure. The problem is, with that old medicine, it also had some negative consequences. One, it was an acidic drop, which means when you put it on the eye, that was the acidity of that drop held the molecule in a stable formation. So it allowed for it to stay active. But it also burned the eye. It caused redness. It caused headaches and eye strain. But it did lower the pressure. So we used it in patients back before we had all the wonderful glaucoma drops that we have today. So it kind of got a bad rap. Why? Because it was a very acidic concentration, and we had to use it multiple times a day. In comes Vuity. Vuity is a completely different formulation of this medicine, pilocarpine. And how it works is it does something that's very, very simple. If you've ever come into our office and we use what's called a pinhole, here's a picture of a pinhole, and what you see here, not a pinhead, a pinhole. A pinhole is a device that we use in the office to determine whether or not glasses will improve your vision. So if we have you look at the eye chart with no glasses on and it's blurry, we'll put a little tiny pinhole in front of the eye. And what that does is it increases something called your depth of focus, and magically you'll be able to see clearer. And so what we know is that by decreasing the field of view and looking through a little tiny pinhole, that can increase your depth of focus and improve your vision. And so this drop, what it does is it decreases your pupil size. It actually constricts your pupil to a level that's been shown to improve your near vision. It's really very, very interesting and also very simple. And so that is the magic behind Vuity. It's a very safe drop that decreases your pupil to improve your focus or depth of focus, in particular up close. And so some of the concerns with this drop were that if we decrease your pupil size, are we going to get less light into the eye and provide a dimming effect? And in the clinical studies that were done, there was shown to be no dimming effect. One of the other possible side effects that was worried about in the clinical studies was the potential for a headache. And so that was something that was observed in the earlier designs of pilocarpine, again, 130 years ago. And it was shown a significantly fewer number of patients in the clinical studies experienced headache. What they did notice, and I think this is the most telling part of the study, and that is that 9 out of 10 people that tried the medicine said that they would like to continue on the medicine and asked to have a prescription for it. That's very uncommon in clinical studies for there to be 90%, sometimes 30, 40, 50% of patients to continue on the therapy would be an absolute benefit and a really great outcome. So in this case, we had 9 out of 10 patients. And so my reason for coming on here today and the excitement I have for you is to let you all know that the first ever eye drop for blurry near vision has been FDA approved. It's a really easy to use, simple, once a day drop, works within 5 minutes and can last up to 6 hours. So if you're one of the 30 million people out there that have been using reading glasses and are wondering, boy, there's got to be an easier way, there just might be. And we would love to have you visit one of our offices, Hazleton, Stroudsburg, or Pottsville, and see one of our doctors to find out if you're a candidate. Give us a call, and we can't wait to see you. Thanks for listening to another Eye Care Today. Have a good one.